Hi, everybody. We have Olivia Miller and Tammy Stone on the line for our EPIC CBO TA webinar today. So today we're going to cover our dashboard numbers, and then we're also going to provide an update on what's going on with the new cohort that we have coming. So right now we have some poll questions up. Make sure you guys are filling those out. I will be covering them up from time to time, but I'll move things and give you guys some time to come back and answer those if you haven't already. So one of the first things we're going to do is we're going to take a look at our dashboard numbers, and I have to say that our numbers look really good. You guys are doing a good job trying to stay on top of everything and make sure that documents are uploaded in a properly manner and things are taken care of. So we do have a few 2151s past due, but no one location has a lot of them. So Albany Park, Instituto, and Tri-County, you have just a few that you need to get cleaned up. So if you guys can try to go in and get those 2151s uploaded by the end of the month, because starting on the 1st, we'll have to start uploading for next month. And then it looks like we have two customers, one from Albany and one from North Lawndale, who are still waiting to be enrolled. You may still be in the process of assessing those customers, but once you guys have determined if you're going to enroll them or not, just make sure you're updating everything in the system. We have absolutely no 2151As past due, so everybody give yourselves a pat on the back, because it's always great to know that we have all of those taken care of. And then we do have a few customers who are in minimal progress, no progress, or situation worse. And we just like to remind you guys that if those customers continue to have those progress levels, a conciliation needs to be done, and DHS needs to be contacted so that you guys can begin working to get those progress levels up. We never want somebody to sit in minimal progress for 4 months in a row. Action should be taken way sooner than that. And then we have some customers who need their completion information updated. So it looks like Asian Human Services, you have 2. CAPS Roseland has 1. Jane Addams has 1. National Able has 1. Southland has 3. And Tri-County has 1. And then we do have a few customers who have also been marked SNAP ineligible by DHS. We just need you guys to go in and exit those customers as did not complete, no longer SNAP eligible, so we can make sure that they're still not receiving EPIC services. We have A Safe Haven, Albany Park, Asian Human Services, National Able, North Lawndale, Springfield Healthcare Forum, and Springfield Urban League, who have a few customers that need updated, but nobody has too terribly many. And then we also have the staffing packets. It looks like we have quite a few that have been started. Or no, it looks like, yeah, we have quite a few that have been started. A large chunk are ready, and a few of them are done. So just make sure you guys are working on getting those completed and taken care of for the upcoming staffings that you'll be doing in April. And if you guys have any questions or anything on any of the dashboard numbers, definitely send me or EPIC or Dee an email. We can definitely work one-on-one with you if you're having any issues with any of those customers. Do you guys have any questions on any of the dashboard numbers that we went over before we move on to our next agenda item? All righty. So our next agenda item is an update on the new cohort. We did receive approval from FNS to go ahead and move forward. So on the WorkNet end of things, we are going to get started on creating the new invitation process that you CBOs will be using. We also have to make some updates on DHS's side as well, because it'll be a little different for them. As we continue to get that built, we will be updating the instructions and providing training on how you will use that invitation process. We do not have it built at this point yet, so there's not much we can give you now until if it's actually been built and put into the system. And then we will start doing training and focusing on those updates on our webinars. But for now, I'm going to turn things over to Tammy Stone with the Department of Commerce to give you some more information.
Hey, good afternoon, everybody. Sorry, my voice is kind of crackly right now, and then I'm also on my car phone, so hopefully you can hear me okay. Yes, it's really exciting. We did receive news from FNS on Monday that the new cohort is a go. We also received news from them that the modification we put in that's going to address the budget line item, the 10% admin and 40% for crew and navigation, has been approved. We haven't gotten the final notice yet from FNS, but we have been notified, personally over the phone that is going to be approved. So there's a lot of moving parts that's going to happen right now. We've got to review our intergovernmental agreements with our department and DHS, and then also our agreement with SIUC for the WorkNet system. So all of that is moving, and then we're going to be looking at modifications again. So we're going to be modifying. Everybody submitted their budgets and performance documents to me so that we could take a look at what you anticipate you can do between now and the end of February. And so we're going to be using those numbers to identify what resources are going to still be unexpended, and we do have some money that's not going to be expended that we're going to have to return back to FNS probably by the end of this month. We're going to give Jackie, who's our liaison with FNS, the information related to what we think is going to be unexpended. And that was based in large on what you guys provided to us on the budget that were required not that long ago. So what we're going to be looking at is modifications to your grant agreement. We'll be modifying the budget line items to comply with, so that you can move the funds around between your, your training and support services. And what we're going to allow is under training, support services, and paid work experience, that's 50%. But based upon your program design, we're not tying any percent to any of those. So you can kind of allocate where those funds are going to be attributed if you're doing more training or if you're doing, paid work experience. If you want to increase that opportunity, you can increase that opportunity, or if you need more money in support services, that's going to be up to you guys locally how your program is running. So that's going to be done here probably this next month. We'll be looking at modifying the budget and extending the grants. If there's any concerns with any of you guys as far as doing this or extending the grants, you need to communicate with me and let me know what those particular concerns are, or if you're even, if you're considering whether you want to extend it or not. I need to know that also. And like Olivia told you, there's some system changes. The front end is going to be a lot different. After that, it's going to be the same. So basically, your enrollment dashboard is going to be a lot the same. You're just going to do the same activities. You got the 2151A you still have to do. So all of the policies and procedures related to the DHS employment training it still applies. What we're working on right now is that front end and how these customers are coming to you. And once again, you guys can do the outreach also. So DHS is still going to be sending customers your way, but this gives you guys an opportunity to do outreach and try and get customers in your organization also. And one of the things, and I hope this turns out really well, because one of the things that FNS is really interested in is how this intake process is going to go, especially for the mandatory groups. There's been a lot of work around the country, especially with the SNAP success, where it's been voluntary SNAP recipients that have been participated. So they're really interested to see how this whole front end and intake works with a mandatory group. And I think that, if we knock this out of the park, we can nationally demonstrate how we can serve, mandatory customers through a referral process. So, and that's not even done with the regular SNAP ENTs. With the regular SNAP ENT, customers are assigned to the provider. So I'm really excited about this. There's some things that we want to try and do. I'd love to do a career fair. It's not been approved at this point, but we'd like to try and maybe do something like that so we can get volume of customers together. But the main thing I want for you guys to start thinking about is that front end, and how can you outreach to SNAP recipients, and specifically ABODs, who's our target population. How can you do outreach to them to get them to come in? And some of the things, you can't do any service delivery at this point because there is some, we need to make sure the system's up and running, and we need to make sure that these customers are not currently in the control group or the treatment group, and we need to verify eligibility with DHS. But there's certain things that you guys can be working on as far as your recruitment plan. And if you have other programs, that you're doing outreach for and orientation for, then, determining, okay, of these participants, these people are on SNAP, participants. So can we filter them into the EPIC program? So a lot of moving parts, but they're going to be really quick moving parts right now. And I think that's about all I can tell you right now on the new cohort. We're excited. to get this going as quickly as possible, and, we're excited to see how that front end is going to, develop, especially when you guys have control of the recruitment side. And also, I just want to let you know, too, that they are not going to be randomly assigned. So if you were assigned a customer, and they're not a good fit for your program, you don't have to serve them either. So we can send them back to DHS, and they can realign with another provider. But it's not like the treatment group was, where they're once in the treatment group, always in the treatment group, and we have to figure out a way to serve them. If they don't fit your program, we can send them back to DHS also. So that's, Olivia, is there any specific questions I can answer on this right now? Hello?
Hey, sorry, it's on mute. Yes, I do have a few questions. Kelsey asked if she will be receiving this information in writing.
Yeah, we can follow this up in writing, definitely.
Okay,
we have a
and
timeline
then,
that we're working through too, so we can share this information as far as what our projected timelines are going to be on this rollout.
alrighty, and then Kelsey also says, I am doing an information session on April 7th. I will need directions for the enrollment referral process before then. Kelsey, are you referring to the enrollment referral process as it pertains to the system, or more of the policy behind that? So we don't have the system built, so we cannot give you any good, solid information on that because it's all subject to change once we get in and actually start building that front end. We have a general idea of how it's going to work, but we have no system to even walk through to put instructions together for that.
But to add to that, Chelsea, this is a high priority on the system side of it, because we need to get this up and running as quick as possible, because we are on such a short, time period for this. So, a lot of what you can be doing on the front end is determining if these are people that you're going to serve to begin with. And, you can do some, if you're doing interviews or orientations for a broader, program, you can identify those individuals, and that'll help. And then you can have a pool of individuals that hopefully within, just a couple of weeks we can get enrolled.
Tammy, it's a little hard to understand you.
I'm sorry. Is that better?
Yeah, that is a lot better.
Okay. But I said, what you guys can do is on the front end start identifying people who you anticipate that would be good for your program, that are SNAP recipients that you can enroll in the EPIC program. But not, and once we get the system, because the system has to do a couple things. It has to determine if they could be served if they're not in the control group or in the treatment group. It's one of the things. And then we need to determine eligibility through DHS, which we can do that electronically, and we don't have to do that. The customer does not have to go to DHS.
And Jonathan, to answer, or no, Eric, to answer your question, yes, we will be doing trainings. I'm pretty sure we will be doing some in-person ones. Tammy, do you know for sure on that?
Yes, we will be doing some in-person. We'll do one in Chicago and probably one in Springfield.
So yeah, we'll definitely be getting those trainings done. Once we, as Tammy said, we do have a timeline. We are still working on approving that timeline. Once we get it approved by FNS and DHS, and on our side, we will send that out to you guys, and it lists like when we plan on having the system built, when we plan on having Kelsey. You said it's hard to reach out to people when you don't have anything to tell them. We are updating marketing materials and everything so that it is applicable for this new cohort, and we'll have those available to you all so that you can start using those to work on recruiting people in. And it breaks down when we plan on doing everything to give you guys a better idea of when stuff will start coming out. But as I said, it is not approved yet. We don't want to give it to you guys and have you guys think we're going to have it ready and something come up during the approval process where we have to change it. So once we get it approved, we'll have it sent out. And then I also have a question from Loris. She says, so will the eligibility be available through the dashboards or via email? Loris, we are planning on having a dashboard for that, one that would notify DHS when they need to come in and do eligibility, and it's only going to give them a specified amount of time to come in and get that taken care of so you guys aren't waiting a long time. And then on your guys' end, we'll have a dashboard to like notify you, yes, they're eligible, or no, they're not eligible. If they are eligible, it would be like a yellow row saying that a next step was needed on your guys' part. So it'll work very similar to all of our other dashboards. Kelsey says, I understand you cannot give us a specific timeline, but can we have an estimate? Yes, Kelsey, I was looking at the timeline this morning. We're hoping to have everything approved and ready to go by the first part of April. And then we can get started on getting everything programmed, hopefully have it all programmed and ready to go by May 9th. And then we can start working with you guys on training mid-May. And then Eric says, sorry if you answered the question about the in-person training. I had someone come into my office a second ago and didn't catch the answer. And yes, Eric, we will be doing in-person trainings. We'll probably do one in Chicago and one in Springfield as well. And then we'll also continue to do our TA webinars. We'll do small training sessions, but we'll also have some bigger in-person training ones as well. Looks like I have quite a few people typing, so we'll give it a few seconds to see what other questions we have. So
hey, and while
says,
we're waiting for the questions, Olivia, if you don't mind, I'm just going to let you know, one of the reasons I'm on my cell phone is we're doing bidders conferences, so we have 3 opportunities available through the WIOA program. And I just wanted to let you guys know about them if you haven't already heard. And if you go to the WorkNet site, IllinoisWorkNet.com, they're all included in that. So we have a career pathways opportunity to use. We have a talent pipeline management opportunity. Those are both participant serving. And then we have an innovation opportunity, which can be a non-participant serving opportunity. So there is a session in Chicago next week, I believe, and there's one in Rockford also. So I just wanted to throw that out there, that there's 3 opportunities that are available through the WIOA system if anybody's interested.
And I have those up on my screen, so when you all go to the Illinois WorkNet homepage, which is this page right here, it's right under the announcement section. These are the workshops that DCO actually has available. One was yesterday and today, but they have 2 more coming up. And then we also have listed out the 3 programs that Tammy was just talking about. And you can click this more information, and it's going to take you to a page specifically for that NOFO. Alrighty, so we'll jump back in over to our questions now. So let me find where we left off. Alrighty, so Carmen says, so if we were to recruit someone next week, what would we need to tell them? We have a time-sensitive event and need to know what to do with interested customers. So, Tammy, and correct me if I'm wrong, for any customers that you guys find now and before we get everything set up on by May to get you guys your training, you're probably going to want to wait to have them come back in and actually get enrolled into EPIC towards the mid and part of May. There will be no way to add these customers into the system until we have it built on May 9th. But even then, we're going to be doing training and everything that first week or 2. So I'm not sure how comfortable you guys would be with wanting to get into the system before training.
And I agree that we do test, there are some priorities. We need to make sure that they are eligible based upon DHS and also based upon not being in EPIC right now. So those are 2 key things that we need to make sure we're looking at. So yeah, I would definitely do your outreach if you have a customer that is EPIC qualified. I mean, I hate to keep a waiting list or keep a list of them, but I mean, what the goal is to expedite it as quickly as we can. So I would definitely keep them in the loop. And if you're co-enrolling, you can always, if you're going to do a WIOA program, you can always co-enroll and get them started potentially with one funding source, and then when EPIC gets up and going, if they qualify, then you can also enroll them in that.
And so Kelsey's follow-up question to that was, so the goal number we submitted aren't actually for the time we were told, they are for 2 months less than that?
And Kelsey, that's fine. That what you guys submitted, that's not actually going to be your modification. So what the main purpose of that was to see what you guys could do, what you anticipated you could do. So we will be communicating with you and actually coming up with a scope of work and budget for an official modification. So if it's a little bit different than that, that's fine. The main purpose of those documents was to determine what we can actually do between now and January or February, so that we can, let FNS know that.
Alrighty, and then so I'm going to come back. You guys have some questions that you just put in, but I got to go back up. We have some that we skipped over. So Margaret asked, we have a group starting April 30th. Will we be able to go back and enroll some of them after the training in May? So you have a group of customers who are going to be starting a training program April 30th then? And Tammy, how would that work? Because you guys won't, because the system won't be built, there will be no way for DHS to provide eligibility and to track those customers.
Well, and once again, this would be something where you could potentially co-enroll them if you've got other funding sources, and if they are determined eligible to be an EPIC, then you can, put them in the EPIC program.
Okay. And so then Eric asked that he understands the system isn't going to really be in place until June. However, can they provide services, enroll participants, and just put the information in once the system goes live? From the system standpoint, I would not recommend that.
Yeah, and I think that's dangerous because if they're not eligible for some reason and you provide a bunch of services, then those are costs that you're going to have to absorb. So that is a little, like I said, once again, we're going to try and get everything, put together as quickly as possible to make this so hopefully in May we can actually start service delivery. But I would caution you to, at your own risk, to make sure that if you're going to be doing something like that, I would recommend that you have another source that you're starting it up with, just in case this individual for some reason is not deemed eligible.
And then, yes, Kelsey, to your point, it could risk disallowed cost if that were the case. And then Eric says it sounds like everything is approved. Eric, it has been approved by FNS, but we have to completely rebuild the front end of how EPIC is going to work to put customers in and do eligibility checks. That also requires that policy and procedure be implemented throughout the system. So we have a lot of approval and research to do on our end to make sure that we are using proper forms and proper processes for checking eligibility, notifying the customers, getting them the proper paperwork. So there's a lot on our end that we're still working with DHS to figure out and make sure everything is going to be set up properly the first time, so we're not having to make continuous updates to the front end of the system after we get the new cohort going. So we have got approval by FNS. Now we're just working with DHS and SIU and Commerce to make sure we have the policy and process and the new way things will work ironed out so that it'll incorporate everything we need it to.
And this FNS approval was contingent on us being able to collect the data and keeping this group separate. So, this is part of what we need to do in the system side of it. It's contingent because we need to be able to track this information and track the same information we're tracking for the treatment group. So there's some contingencies with FNS's approval that we have to meet specific criteria for this new cohort.
I think Kelsey says, so there will be no way to check, no way for us to even know if people are actually eligible prior to May. I ask this because it doesn't make sense to keep a wait list if we don't even know if a person's eligible. Carmen, yes, you are correct. The whole front end part that we are building is an eligibility piece that will allow you to identify customers and then notify DHS to tell you if they're eligible or not. So that will not be available until May. But you can keep that list, so then once we have the new system opened up, you can easily go in and just add all those customers at one chunk in time, have an eligibility chunk ran, or eligibility verification ran on DHS's side for those customers, and then you can begin serving them instead of having to, in May, go out and start finding customers to check eligibility for. And then Eric says, DHS should be able to tell us whether they are eligible. Essentially, they meet the SNAP requirements, aren't TNF, and are not put into the control group. Correct me if I'm wrong on this. Yes, DHS will be telling you if they're eligible, but it will be through the online EPIC system to make sure that we have everything documented in one place. DHS is also in the process of, we just built a control group reporting system for them for the other half of the customers who came in and were put through eligibility review to see if they got EPIC. So DHS also has a lot going on because they're learning a whole new control group system, and then they're also going to be learning this new front-end system as well.
And Olivia, correct me if I'm wrong, but I think what the process is, will be is they're opening up right now. DHS can put in a minimal information on a customer, that just some of the main information, and determine if they're in the control group or treatment group. What we're doing is opening that up so the CBOs can do that. So when you're meeting with a customer, you can put in, like last name, first name, social security number, whatever's required to determine if they're in the treatment group or control group. If they're in that, then there's no reason to continue. If they're not in that, then we will be sending DHS a notice saying, okay, we needed to verify eligibility that they can be an EPIC, and they're supposed to respond back within 48 hours of yes, they can or no, they can't. And then from that point on, then you're sailing. I mean, you finish the application, and if they're eligible, you begin serving. So that front-end piece, we're hoping is going to be really quick and efficient. It's just that we couldn't do anything on the programming side until there was approval to do this. And we just received the approval on Monday, I mean, literally. So as you guys know, it doesn't happen overnight when you're trying to change systems. And so we're going to expedite this as much as we possibly can. But based upon some of our criteria with FNS on the data that we need to do, too, we need to make sure that we have this up and running. And for your sake, we need to make sure that we're able to verify eligibility so you're not serving people that will have disallowed costs.
Yeah, and so one of the other comments in here is, Eric, I am not waiting for a response for DHS. That's an absurd workaround given how slow they are, but we have to wait for DHS. DHS has to verify they're eligible, or any costs that were spent on them will be disallowed because we can only serve SNAP-eligible customers. So it will be really important that you're using the system. You have to input every customer in there. They cannot be in the control group. They could not have ever been in EPIC before. They have to be SNAP eligible. And then we had another question regarding if they're in any other JPP programs. That's something DHS will also be checking. They'll be looking to make sure they're not also enrolled in another program somewhere, and they'll notify you. I think we said, what was it, 24 to 48 hours, Tammy? DHS would come update the system.
There is, though, if there's a possibility of a customer is in JPP, and specifically if you have a JPP program also, and they come to you, and we did get this proof through DHS that if they come to you and they're in JPP and they really, really want to be in EPIC, that we can serve them in EPIC, and that was approved through DHS. So there's that possibility that they can, if they were aligned with the JPP program, they can come into EPIC. We just need that communication tool to go back to DHS and let them know that they're going to be served under EPIC.
And then before I forget, I also wanted to let everybody know, I was looking at some of the calendar appointments today that we have for our CBOs, and I noticed that we had some CBOs who do not have any appointments put into the calendar. DHS is working to re-engage customers, and with this new cohort coming up, it's going to be very important that you have at least 2 months of appointment dates entered into the system. It's also policy, so you guys need to make sure that you're staying on top of that and have plenty of appointment dates available. All right, so we'll go on to our next question. I still have quite a few more questions, Tammy, just so you know, because I know you can't see the screen.
To tag on to that, the re-engagement is a priority also. So, one of the things that we had to verify, commit to with FNS is that we will have money available for re-engagement of customers also. So that is a priority, is, to re-engage treatment group customers. So with this new cohort, you can't ignore people that are coming to you through re-engagement, that you have to serve them also.
And so I see some comments in here about, I do know that some of you guys have close relationships with DHS. You may be very close to some DHS offices. But we really need to make sure that we're not serving customers until they're in the EPIC system and we have it built. Because if anything is to change with their case, if DHS needs to input anything into EPIC, that customer is not going to be there. You're also going to be creating extra work for yourself because you're still going to have to enter them in how you would enter any other customer in, do eligibility check, do all that. It is a policy that is required to be done, so there's no real easy workaway to get that done quicker, faster, or easier. This is the policy and process that has been agreed upon to utilize for the new cohort.
And part of that is the 2151, which is the referral form, which basically starts the customer off too, which is part of their policy.
And then Devin asks, would we still have to coordinate staffings with local DHS offices? Yes, we still will continue to do staffings, and the way we have been doing them the whole time. We have not been informed of any changes that will be taking place with staffing. It will just consist of more customers once we start getting that new cohort in here. Alrighty, let's see some more questions. I think I answered some of these ones. So, wouldn't those people be in other programs? I didn't think they were able to just wait and see if we can enroll them in EPIC. DHS has told us customers must be active in some program. Tammy,
okay.
Do you have an answer to that one?
Yeah, with that, I mean, if you're identifying customers that they're currently probably not active anyway in some cases unless they are in a JPP, and if they're in a JPP, I don't know if they would necessarily be coming to you guys. Keep in mind, I think there's like almost 200,000 ABODs in the city of Chicago, and they only have so many spaces in their JPP program. So there's plenty of customers that aren't aligned. And the deal is the clock starts when they're referred, which would be through the 2151 form. So if you're doing orientations and you're identifying customers in April, and then you could say, okay, we need, we can start a program, hopefully the first part of May, that would start their clock. So it's like even with a JPP right now, the clock doesn't start until they're actually referred and enrolled with a provider. So I think we'd be okay on the clock side with the customers at least.
And then Carmen says, it seems like it would make sense to extend this cohort until 1 year from when the tool is built, since we can't do anything until then. Otherwise, the extension is pointless because by the time the tool is actually built, we won't have any time to train people.
And like I said, Carmen, once again, this is a priority on our part. I think the May deadline is hopefully the end deadline. We're going to try and get this done as soon as possible. So, there's a lot, like I said, once again, you guys can start identifying on the front end of this. And hopefully it will be nice, with EPIC, it was kind of a wait and see for the referral process and what you're going to get. if we can identify customers in the month of April and have a cohort of customers that you believe would be, EPIC potentials, then we can start them off the box, and hopefully you'll be starting with a larger group and not just have one or two coming in at a time.
And then we have a question from Mary. Mary says, a follow-up to the staffing question, will referrals be concentrated to by DHS office, example, only receiving referrals from a few select offices rather than 11? It is a burden and resources and challenge to travel each month to multiple offices across the city just to staff 1 to 2 people. Mary, as far as I know, we will still be sending customers from any DHS office. We are not doing any updates to restrict that down, that only some offices have access to certain CBOs. Staffing, though, that has been an issue, the traveling and trying to make it to all 11 offices.
And let me just add to that we concur with you that it is a huge amount of time and effort that's put into that. And from our perspective, DCO's perspective, is with this new cohort specifically, we want to see if there's some more negotiation we can do on that part on you guys' behalf, because especially when you're looking at maybe just one customer that probably may not have any issues, and for you to have to drive to do that, there's not a good return on investment on that. So there's conversation that we're going to have around that, try and make it a little bit more user-friendly, I guess I'm going to say, and less time-intensive.
And I think, Devin, that probably answers your question, too, about trying to do things more online over the phone, especially for 1 or 2 people. That's something that we do have to get approval from DHS because it is their policy that these staffings are done. But as Tammy said, it's something we're hoping we can get changed for you guys, because we do understand the time and resources you guys have to put into doing all of that. And then Eric has a question. He says, regarding re-engagement, we had a customer complete, employed for 90 days, etc., and is now listed as SNAP eligible again. If we re-engage a customer that has previously completed and been retained, does that count as a second registration, i.e. the process starts all over again?
Okay, that one is a wee bit of a tough one because they have been, and they were employed, is my understanding, for 90 days. Eric, let me get back with you on that because, the intention is with the EPIC program is to get them, sustainable. And we don't want this to turn into just a JPP where we keep recycling customers through. So I will follow up on that. That's going to have to be a question that I'm going to have to ask above my pay grade.
And then Laura has a question. Will CBOs have access to IES so that they are able to determine eligibility?
If you complete that questionnaire that DHS did a webinar on probably about a month ago or a little over a month ago, there's some documentation that's required. If you complete their documentation and then if you pass through their security examination, then you can get access to IES. But that's something that you're going to have to do, on an individual basis. It's that, you have to fill out that documentation and submit it directly to DHS to get access to that.
And Laura's, I do know that there's been some conversations about IES and the Manage My Case that the customers have access to. And DHS did point out some of the issues that could come about by trying to use that because it doesn't necessarily give all the information that may be needed. Like you may know they're eligible, but they could be engaged in other traditional SNAP programs, and that information might not always be readily available in that system. So that was one of the reasons DHS actually wanted us to go with putting in an eligibility check into EPIC instead of using the systems that they have built. And then Kelsey says, wait, can you answer Eric's question again? Kelsey, the answer to Eric's question was that Tammy is going to have to ask somebody above her pay grade and she'll get back to him. So I'm sure she can include you in that response as well. Autumn says, I have 2 customers that had dropped out of school and called and said they were back in Epic and want to go to school again. So Autumn, for those 2 customers, they can definitely be re-engaged back into Epic, but we need to make sure that DHS is updating that on their end to reflect this re-engagement and that they are eligible again. And then if you know the customers, you can definitely reach out to the primary DHS contact at their office and ask them if they can update the system to show that they're eligible and being re-engaged. And then you can work on re-engaging those customers and definitely get them back into school. Yeah, and exactly what Kelsey said. If you do not think they're suitable for the training program or they do not meet the requirements for the training program coming in the second time, you can upload the 2151 as referral rejected. And just make sure that you include a case note that documents what's going on, why they're being rejected. And that is all of the questions that were up. It looks like nobody is typing. So does anybody else have any other questions for us to go over today?
And we will keep you informed either via webinars if we have to do, another one, in between our biweekly, and through emails as far as the progression of what's going on with this. So yeah, the main thing is just to really think about the intake process from your perspective and how you can reach out to get SNAP recipients for your program, and then doing whatever upfront assessments that you guys do to determine if they are even a viable candidate for the EPIC program as far as the training that you're going to provide. I mean, obviously we have to determine eligibility, but are they even suitable for you, the program that you're offering?
And then Virgil says he has a similar question. He had 3 individuals who went through the program. This month they had scheduled dates for them, and he was under the impression that they were successfully exited and wants to know were those people re-enrolled because they needed to be re-engaged. So Virgil, if you want to send me the other participant ID numbers of those 3 individuals, I can take a look at them. But that could have been what happened. They could have been successfully exited, were making enough income to no longer need their SNAP. Maybe they lost their job. Maybe they stopped making so much or working so many hours and they became SNAP eligible again and then were then re-engaged with you. Remember that we do have pre-employment only services. So if you do have any customers who had successfully completed training with you, earned a credential, and then got a job, and then they're coming back to you because they had lost that job at some point in time, you can continue working on employment-only services with them to find them another job. They don't necessarily have to go through a whole nother training if they've already went through training with you guys, got a credential, and got a job. You can just focus on working with them on pre-employment only.
And that's part of the retention services also. So that would be part of, making sure that they're staying, in a specific position. And some of the things that we're looking at, especially our management's looking at, is based upon placement and credentials. And are these individuals actually being employed in the sectors that the training has been taking place in? So the credentials that you're providing, are they getting jobs that's related to that specific career pathway?
Do we have any other questions? Alrighty, it doesn't look like anybody's typing, but as always, if anything comes up, definitely feel free to email Dee or Tammy of the EPIC Help Desk. We can answer any questions that you have. And we will continue to provide you guys with updated information on this new cohort as it's made available to us. And we will definitely look forward to talking to you guys. I'm sure we'll talk to you all probably sooner, but if not before April 11th, we will talk to you then for our next biweekly CBOTA webinar. I hope you all have a great day, and thank you very much for joining.